how long is this going to take and when can I get back to normal? And I think, ding, 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 this person is in denial. So many people who are hurt the most are in denial. Well, Dr. Kasendorf, welcome to Unseen Impact I'm Rory Pendergast, as you know, and we're here today to talk about pain management, what you do as a pain management doctor, and to tell some stories about how kind of things go in the claims world, in the personal injury world, and on the medical side. Dr. Kasendorf, welcome. Thank you for joining us.
Thank you so much for having me. I'm really excited.
Well, to start off, I just kind of wanted to get a little background, your background and kind of your approach to pain care.
Sure. I am board certified in physical medicine and rehabilitation.
And what does that mean?
Great question. A lot of people don't really know what we do because we are, our formal name is physiatrists. So I get, are you a podiatrist? Can you look at my feet? Or can you give me something because I feel a little bit depressed? I'm not a psychiatrist. I'm not a podiatrist. I'm a physiatrist. And what this essentially is, so this specialty is physical medicine and rehabilitation. It is exactly what it sounds.
So who is it that shows up at your doorstep? So let's say if I break my arm, am I going to you?
Well, if you break your arm, first of all, you probably should go to the emergency room. Okay. But second, and then maybe you see an orthopedist. Now, from our perspective, we see people after they come from an orthopedist. So the specialty of physical medicine and rehabilitation covers quite a number of things. We're a little neurologist, we're a little orthopedist, we're a little primary care. We cover so many different things, rheumatological conditions, and we'll cover people who come in with injuries, but it's not just the physical injuries that we may see. The main components of what we see may be orthotics and prosthetics, which are braces, and people come in those kind of injuries. People who have strokes, and after the strokes, not so much the acute stroke management. And a lot of physical injuries that people can be born with, or people unfortunately incur over time. And so,
in my world as a personal injury attorney, I get people who they suffer some sort of injury, right? Maybe it's something what seems like a minor rear ender. Maybe it's somebody who's walking across a crosswalk and gets hit by a car. And in my experience, when you get hit by the car at a slow speed, that's not what hurts you. It's that energy from the car that throws you down, and it's you hitting the ground that hurts you. And so I see somebody who, maybe they've got some medical issues, they go to the ER, they see an orthopedist, but after 6 months, 8 months, a year, they're still in pain. Is that when they go to you?
Well, maybe before then as well. We get people who come in maybe for the first visit, they may see us as well. If there's something such as an unstable fracture or something that needs to be taken care of right then and there, obviously you want someone going to see somebody that can do surgical intervention. We don't do any surgical intervention. But it's interesting you said, even with the slow speeds, even at someone getting hit at 4 miles an hour has been shown that can cause significant damage to a person or property.
And so you had mentioned about even neurology and the different sort of areas of medicine that you cover. So are you studying that in school? When is it that you're kind of getting into that section with respect to the pain management?
Well, the pain management comes along with the specialty itself. As I said, there's different pillars with what we do, and a lot of it involves dealing with painful conditions.
And so tell me about when did you become a doctor?
Well, I actually graduated medical school, 2003.
Okay. So you've been at it for a while.
Oh, yeah. I actually did everything. I went to University of Maryland for my undergrad, and then I went over to, it was very fortunate. I was able to live at home. I got to and save a lot of money. While I was in medical school, I went to New York College of Osteopathic Medicine.
Okay.
And that was all in New York. And then once Hurricane Sandy came, destroyed our whole town, basically. Yeah. We just picked up and moved here to California.
Okay. All right. And then so what do you do postgraduate? You've got you're an MD. Then what was your next step?
Well, technically we're DOs, and there is a I just want to differentiate between MDs and DOs.
Sorry about that.
So MDs and DOs each are doctors in the United States. I chose to go to an osteopathic medical school rather than an allopathic medical school. The allopathic medical schools develop an MD, and the osteopaths get a DO when they graduate. And there are some differences. Unfortunately, a lot of us DOs don't do a lot of the extra DO stuff that we learn in school.
Yeah.
But from DOs, we do get a little extra training when it comes to osteopathic manipulation. And there's a certain type of philosophy that's ingrained, that's a little bit different compared to.
Okay, so what was your first, do you go into a residency after school?
Yes. So after medical school, graduated in 2003, I did a 1-year traditional rotating internship. And then I did 3 years of in the specialty of physical medicine and rehabilitation. Now, after that, I did take specialty board in pain management.
Okay. So tell me, is this a traditional path that pain management doctors go through?
For the most part. Now, technically, anyone could do, any doctor, not anyone, any physician can do pain management, but the most common pathways to get there would be from physical medicine and rehabilitation or anesthesia. You do see some from the neurology side get to pain management, but it's less common.
And so what was it that drew you towards this area of the practice?
Well, I will tell you, and it's kind of embarrassing. I was about to graduate medical school and I still didn't know what I wanted to do. I'm like, well, I don't like standing for 8 hours. I don't want to be a surgeon.
Yeah.
I want to eventually pay off student loans. So I don't know if I want to be a pediatrician.
Mm-hmm.
And I don't want to, and I'm not so much into numbers and this, but you know what? My wife being an occupational therapist, that involves a lot of physical rehab in itself. She works with pediatrics, which is a little bit different.
Yeah.
But it actually got me very interested. I had a friend who convinced me to do a rotating internship elective, and I loved it. So I ended up doing this specialty, and I ended up really, really thriving in it. It's one of the things that it's a real passion to me to really get people where they need to go and improve the quality of life.
From my perspective, it seems as though you in this field have to take kind of a more hands-on approach and know your patients more than perhaps other areas of medicine might. Am I right in that respect?
I can't speak for other doctors, but one thing I do pride myself in is I know my patients and I know them well. And sometimes I run late, but that's because I'll put the blame on myself. I probably talk too much.
Yeah. But I have to.
I do get to know them.
In this sort of field, from what I can see from the injury context, right? So somebody gets injured, they have some sort of, acute injury, they have pain that's going on, and with that pain, it's not just that kind of acute pain that's the problem. So for instance, if, somebody has some sort of long-lasting chronic pain, it's impacting their sleep, which is impacting other aspects of their life. And so in pain management, to me, from the personal injury side, you have to know kind of the whole picture of what's going on with the person's life. What would you say to that?
That is on the money, exactly what I talk about all the time. And I want to make one specific point. When we say pain management, a lot of people think, I'll just go there and I'll get some pills and I'm going to be out of pain. Perfect. Well, if we practice like this, pain management would be this.
Yeah. So let me ask, if I can guess, what you're saying is that if you had anything you wish people knew more about pain management, it would be that it's not simply about giving pills.
No, and I will tell you, it's so important. First of all, I like to call it pain alleviation.
Oh, okay. I like that, pain alleviation.
Well, not so much pain. This is pain alleviation. This is not going to get rid of your pain necessarily. If you're going to go on and have chronic pain and you have a condition that is just never going to go away, that may be what it's going to be.
So some of it is that, from what I'm hearing, and this is what I've seen as well. For instance, I had this case where it was a CHP officer got hit by a car. He was on a motorcycle. Very, very massive injuries. Broke like 25 bones. Ruptured a bunch of massive organ systems in his body, and the guy just had massive pain, which then meant he wasn't sleeping, which then meant his body can't heal, which then meant there was all sorts of other, cognitive issues that weren't, maybe it was cognitive because of the brain injury, but some of it was cognitive because he can't sleep.
Well, let me tell you specifically why what you're saying is so important. Pain management is, as I said, it's not just here's the medication, what I call bug and drug. Here's a problem, here's the pill. Here's a problem, here's a drug. That is not what we were trying to get. No bug and drug. But especially when it comes to physical medicine rehabilitation, my specialty, one of the main focuses with our specialty is really discussing what's your quality of life, what's your overall function. Function is much more important than pain. You could live with pain, but if you can't function, you can't function. Now, that may involve starting some physical therapy or occupational or hand specialist. It includes psychological aspects, maybe cognitive behavioral therapy, seeing psychology, and including acupuncture, massage. All these different modalities are so important to get an overall improvement of function outside of a single narrow
and this is what's so fascinating about the areas. Before doing this sort of personal injury, before getting into this, I had no idea what a pain management doctor. If you were to tell me what a pain management doctor was, I would have thought what the bug and drug, right? Just give them drugs, away you go. But starting to really realize that you're kind of the quarterback. You're the one that you see the entire field. You see what the possibilities are and the danger points are down the field, and you know kind of where you have to send them. And so it means that you have to know all of that stuff. And not only that, you have to know everything you can about your patient.
When doing hospital, when there are a lot of us physiatrists or physical medicine rehabilitation physicians, when we start out, most of our work is in the hospital. And when we're doing inpatient work, we are essentially, as you said, the quarterbacks. Yeah. We basically run the meetings where we have the therapist, the psychologist, the social worker, and everyone's in a group. And you have your treatment team, and that essentially is our role. And as an outpatient, we take that over, and that's our main function.
And you're doing outpatient right now.
So speaking about outpatient, it's the same thing that we were doing on inpatient. We are quarterbacking the patient's care. We see them, we assess them, we do a thorough assessment of what their actual needs are, and refer them out to all the different specialties that they may need, and ensure that they improve the quality of life that's necessary. Now, we try to obviously avoid some of the heavier medications, and that is a big issue. But there are a lot of...
Especially now, it's a huge issue.
Like, my gosh. But sometimes they are necessary. But, obviously we have so many great options now that we don't necessarily have to go to those options.
Yeah, one thing that I've seen often, right? I've gotten calls from people, and they say, they describe their injury. Even some people, you fall at a grocery store, or you're in a motorcycle accident, or you're in a rear end or a T-bone like auto crash. And I've had people call me, and they just start to describe the pain that they're feeling, sort of that injury that they're having. And I'm thinking to myself, it's like, wow, you got really messed up. Of course, I'm not going to say that, especially on the first call. But then I get this question. But okay, Rory, how long is this going to take, and when can I get back to normal? And I think, ding, 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 this person is in denial. And what I see from the injury side of things is that there are so many people who are hurt the most are in denial. So to what extent do you see that in your practice?
I see that quite a bit. And they come in and I'm just going to get better, and they just get very frustrated, and it really pays a psychological toll on them.
Absolutely.
You see them get more depressed. They lose sleep. They have poor family relations.
It's kind of this spiral downwards.
It absolutely is, and it's so important. And I love the fact that you're doing this podcast to bring light to all this. One thing I would highly recommend is bringing in a psychologist person who I think would definitely shed some light on this even further.
And absolutely. And so some of the issues that I have with people is, like anything, you can't, if somebody is in denial, and you can't say to somebody, well, you know what, I'm sorry, sir, you're in denial. So can you just get out of denial, and then we can move on with it? You can't do that, because the person has to come to the realization, him or herself. And so what are some of the things that you might do in your practice that can help the person? Is it just you give them time, or what is it that you give them?
Well, one is reassurance. And you acknowledge that it's okay to be in pain.
Okay.
Now, I'm going to tell you a quick one. I'm going to get to your story in just a second. I had this lady come in, and I mean, she has the worst rheumatoid arthritis. Her hands are all deformed. Everything. I mean, she could barely move, and she just goes, her quality of life is terrible. She can't do anything. She goes, I just don't want any opioids. And I'm like, listen, I'm not trying to push drugs on you, but no one's going to knock on your door and say, hey, congratulations, you didn't take any pain medications, but you suffered.
Yeah.
It's okay. we're not taking long term, but maybe for short term, if someone's in a severe car accident, for you to take some medication, for you to get some help. And a lot of times people they're like, I'm all right, I'm okay. It's okay.
And I think from what I see is that because of that pain that's going in, and so often what I see and what I tell people is, they come in and nobody wants to have pain, whether it's from some sort of acute trauma or whether it's, rheumatoid arthritis, it's long term. They don't want the pain, and it's a nuisance. It's difficult. It's a pain in their keister, right?
Yes.
Beyond just physical pain. And so you get this in your mind, oh, I don't want it. And all of a sudden people have blind spots. And so what I've noticed in as the personal injury attorney is the worst person to talk about how they're feeling is the victim, is the patient, is the person who's hurting. What I do is I go around and I talk to the friends and family, the people that are closest to them. And what I say is that close in heart or proximity. Hey, you've got a brother that lives 4,000 miles away, but you talk to that brother every day. Or there's a grocery clerk who you don't know what that grocery clerk's name is, but you see him 3 times a week and you talk to them. Those are the people that are going to know about how you, the victim, you, the patient, are doing. So in your practice, I mean, it's easy for me because I can pick up the phone or I've got a couple people that help me out with this. What can you do to really kind of dig deeper and find out, how much denial is this person in? How much, or who is it that I can talk to about kind of trying to convince them?
Well, doing a good thorough history and really delving into a good physical examination and acknowledging, I understand that you must be in a lot of pain. This is terrible. And I want to tell you something on a personal note. Yeah. It's probably been about 2 or 3 times, probably 3 times now, where I've hurt my own back. Now, I'm not sure if you've ever been injured, but on this case, I was down and out. I could barely move. Now, the first day, everyone's, oh, let me help you. By the end of 2 weeks, and in my cases, thank goodness, each case was probably about 2 to 3 weeks. Yeah. By the end of 2 weeks, you're bitter, you're angry, and you know what? Nobody even really wants to help you out anymore. Now, I had this 2 weeks, 3 weeks. Can you imagine someone having it 2 months, 2 years, and how much their life goes down from there?
It's got the story of the lion with the thorn in the paw, right? Yes. I mean, it's just has to. So, for instance, when you don't sleep at night because pain keeps you up, then you wake up, and one is that your body has not had a chance to heal, your brain has not had a chance to heal, and then you're just miserable. So then it impacts everything. So okay, now I can't go exercise like I used to do. And maybe the exercise is where the person got it, like the joy in life. There's all of these things that it just slowly starts to chip away at you.
Okay, so first of all, it's very important to address the pain that is there, acknowledge that they're in pain, but it's also very important to be aggressive.
By aggressive, what do you mean?
Okay, so I can't tell you enough how often I see this from, unfortunately, some other providers where they're like, oh, I have all this injury. They have this quick assessment. It's cursory assessment. And then it's, oh, start physical therapy and see you in 6 weeks. Yeah. What the hell is that going to do? Now, physical therapy is going to help. I'm not going to, but from
the holistic approach, looking at the person, talk to them. Yes. What is it that's going on with you? How is this affecting your sleep? How is this affecting your work? How is this? And then that is going to, like you just said, it's going to affect your relationships. And now those your loved ones, those that are there to take care of you, that are kind of watching after you, are bitter themselves because, like, man, this person is terrible.
It's absolutely awful. And people lose everything. They lose their jobs, their relationships. And one thing I actually do, in my office, I do a lot. I always say, I don't want to be the person who says, in my office, but here I am doing it in my office.
But here's the thing is that what it goes through is that you've been doing this for over 20 years. And so when somebody comes to you, they're not just coming to you as the doctor, they're coming to you as the doctor with 20 years of experience.
Well, I will tell you one thing, when they come in with headaches, I have this belief that goes, someone who walks in the room should leave the room feeling better than the way they came in.
Okay.
The last thing I want to do is say, oh, you have a problem? Here's a piece of paper. Good luck. Yeah. Because then they leave the doctor like, okay, great.
You mean
now
the paper isn't just taking care of everything?
No. So literally everybody that walks into my office should leave at the very least, knowing more. So what do I mean by that? So if someone comes in with acute pain, you could give a little anti-inflammatory injection right then and there. You could do some osteopathic manipulation. You give them a heating pack. This also comes from a story when I was a resident, and it's something that I've actually taken with me in my entire career. During my residency, I did this. Someone came into the hospital. I said, "Oh, look, they got back pain." I wrote, Dr. P. His name's Dr. Perry.
Yeah.
If you're watching this, anyway, Dr. Perry, I said, "Oh, he's got some low back pain, so I'm going to start some physical therapy. Can you sign the script?" He goes, "Doctor, what are you doing?" And I was like, "What do you mean?" It's like, "What are you going to do for him? He's going to go to any schmuck and do this. You need to go to some place, he's going to go to someone that's actually going to do something for him." Yeah. It's like, give him do a trigger point injection, do some osteopathic manipulation. Give him a freaking hot pack, do something for him, doctor. Why is this guy going to come to you? So that's why I say when they come in, do something for them then there. Talk about nutritional stuff and certain anti-inflammatory foods. I'll tell you some of this.
I like that because not just anti-inflammatory foods, but what kind of foods out there are causing inflammation?
Well, there's a number. I'm going to tell you one quick thing. I had a patient 2 days ago. This guy came in and it was the weirdest thing. I told him to stop drinking soda.
Yeah.
The guy drank 8 Dr. Peppers a day, and he goes, "I don't understand what happened, but all my muscle spasms are gone."
Yeah.
I'm like, "You're drinking 8 Dr. Peppers a day."
He was talking to the wrong doctor.
Yeah. So the sugar, sugar causes an inflammatory response. Dairy products cause an inflammatory response. There's the nightshade vegetables. Most people don't even know what a nightshade vegetable is. Yeah. I could go into a whole podcast talking about anti-inflammatory, but I recommend turmeric. I recommend all these different nutritional supplements and things that are all going to work. If everything works even a little bit, you're going to get to where your goal needs to be.
What it makes me think about is the game Tetris, right? Yes. I mean, my wife is a queen at Tetris. I am terrible at it. I'm always ding, 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 ding. And so what it makes me think about is with all of this stuff going on, whether, even it's just the food that you're consuming, a personal injury client, a patient could have a small issue that if it goes unchecked, that it can become kind of this long-term chronic pain, right?
Now, nutrition may be like, "Oh, I stopped eating McDonald's and now I'm out of pain." No, but you know what? You stop eating McDonald's, maybe it's 5%. Maybe you stop smoking, another 5%. And you do all these different lifestyle changes. You start getting at least a walk every day. I had one guy who stopped drinking. He would drink like a gallon of milk a day, and he stopped, and he lost 30 pounds, and now I took him off 90% of his pain medication.
What's wild about it is that most people, whether it's from a lack of insurance, from a lack of knowledge, they don't know where to get, and they go to their one doctor, and maybe they're not getting that holistic approach to it. And so this is what's kind of wild, is that it seems that there's this sort of misconception out there, and that the doctor that can do more and can look more at you is the one that can really impact you. Right? Because it's all what I'm hearing is it's all of these little steps or lack of steps that can, even a small something or maybe something big, that it stops you from being able to resolve the pain. And one thing that I really like that you said a few minutes ago is about living with pain versus functionality.
Function is a lot more important than pain. People live in pain all the time, every day. And if you could deal with the pain, it's to do with the pain. It's the function. If you can't sleep, if you can't have good relations with your spouse, or you can't. Yeah. I mean, people talk about sex. I mean, people's like, "Oh, okay," and people kind of get a little smirky, but that's actually a big part of people's life.
Yeah.
And if they can't have sex, or they can't enjoy their life, if they can't enjoy their lives, that's a big quality of life issue.
One thing that I see a lot is, and I know from my own self, right? I'm a runner, right? I mean, I've run marathons, but now I don't. Now, with all the kids, I can't. So I try to run 3 miles. I do every day. I try to run 3 miles, right? So it's kind of, for me, it's kind of the sweet spot. It's 2 just doesn't quite do it, physically and mentally, and then more than 3, it doesn't do anything more than that. But so I think for myself, the ability for that exercise, whether it's 3 to 5 times a week, and that there's so many people out there, especially in Southern California. I was born and raised in Montana, right? So there's, most of the year you can't go run, or else you're going to slip on the ice and break a hip. But so here, I think that people have an active life, and in today's age, people are active. And so when you have pain, it can stop you from being able to exercise and do those other things in life that you enjoy. How do you approach explaining that or talking about that to patients?
Well, it is important that I explain to people, it is important to stay active, continue to do what you can do, and don't give up and just say, F it, I'm just going to sit on the couch and watch Netflix. They need to continue to be active. They need to continue to do the therapies. And I understand that. I understand the mentality, because they are at the point where I can't do this.
Yeah.
And, and also if I refer them here, refer them here, they're like, well, I don't want to go all these places. But let me tell you something. The most important thing I've learned is not what I've learned. Yeah. The most important thing I actually know is that it's more important to know what you don't know than to know what you know. So I see this a lot in different practices, and I see this a lot when I was a younger physician. Yeah. I'm still young, I hope. Is that a lot of times I will, if I don't know, or I don't do a certain service. For instance, I do osteopathic manipulation, but I'm not very good at craniosacral, and that's okay. I know someone who is.
Yeah.
Or I know some of the rheumatologic stuff, but I know some great rheumatologists. I think it's important to refer, and it's important that people continue to do all the work and get a multimodal approach. And it's not just coming from one person. What
I like about what you're saying is that the good practitioner, the good attorney are those that can recognize where they're not the best and can say, hey, I can help on everything else or help on certain things, but it's this sort of area that I think this is the person you should go to. And then I imagine you have a positive response from your patients with that.
I have a very, very strong following. So I'm very loyal, and I love, I've really gotten a chance, especially when you deal with a lot of people with chronic pain. You really get a chance to know your patients. I know after all this time, I know my patients' stories. I know their families, and it's like my family, my friends. And I can
tell you, even from my side of things, from the personal injury side of things, that is where magic can happen. Because the idea of this isn't just a claim. You're not just a number. You're not just a claim number. You're not just a black and white. Just here's this picture. Here's this medical bill. Here's this medical record. You're a human that has feelings, that has all sorts of issues, that has a life, and our job is to try and get them better, right? So what we want to do is, I just kind of imagine that from my perspective, I'm on one side of this raging river, right? And there's this raging river we're looking down, and it's like, that's what you, client, patient, have to get across. And I'm here to help you across that way.
Yes.
And the only way that I can do that is if I know who you are.
And we work with a number of attorneys who are exceptional. Yeah. And we always appreciate that, because we try to keep a good communication with them as well, saying, hey, look, this is our situation. This is where we want to go with this.
It's almost an extension of the medical treatment. So one of the things that I like to help people do is, because somebody goes to the doctor and they could be in pain for 29 days of 30. And then the one day that they're going to go to the doctor, they're feeling great. And so the doc comes in and says, hey, how you feeling? Oh, man, I am feeling fantastic. I slept so well last night. But no, with 29 days, you're feeling bad. So what I try to do is get them, hey, I want you to keep some sort of log, whether now it's in your phone, Excellent. Something like that, to where you can say, hey, what is it that goes on? What time of day does pain show up? What is the particular pain? Write it down, give it to the doctor. Now, I got to imagine from your side, you must appreciate that.
I absolutely love that. We ask people to keep logs just for that same reason, especially when it comes to, is this medication working, or is this one not working, or what time of the day do you get pain? If someone says, all my pain only comes at night. Well, when are you taking medication? You're taking your medication in the morning. Maybe if we spread it out, instead of taking 2 in the morning, we take one.
And so if somebody shows up with this log, with some sort of diary or some sort of, I imagine that must get into their medical records, right?
To some extent, yeah.
Yeah, just so that you can kind of say, and then even if you're going to be manipulating when it comes, when it goes, that gets into it. And in a sense, from the legal side, it's documenting kind of what's going on with you. And from the claim side of things, it's a weird world, right? Because what I always tell people is that, look, if you just fell in your house and it was your fault and there was nothing, you're not keeping track of things. You're not trying to figure out what went on. The problem is that in a claims world, you have one opportunity to seek compensation. And for me, it's not just about compensation. It's about, acknowledgement and truly discovering what is wrong with you. What is the full extent of something that's wrong with you? Because I'm sure, as you know, people come into your office and they may not quite realize the gravity of what's going on with them.
Or someone may come in and I see them limping and they're not even mentioning it.
Yes.
I'm like, did you want to mention that? Or they're like, yeah, my arm hurts. I'm like, oh yeah, but my leg hurts. I hurt my leg also, but I didn't really mention. I'm like, no, we need to talk about this. And they don't even mention it. It's like, what are you doing?
It's really hard as the everyday person, because some of it is that you don't, there's this psychological thing that I've found in 16 years of doing this, is that you just hope. It's this hope that I hope it has nothing to do with it. I hope there's nothing there. I hope it goes away. And if I just ignore it, it's gonna go away. And that actually kind of comes to one question, is that, do you ever have anybody who has some sort of stigma with this idea of kind of long-term pain?
Yes, as a matter of fact. And it's very interesting. And now this is not 100%, but the bigger and stronger the man, the bigger the wimp. So you'll get, I don't know. And I will tell you, certain cultures also are very susceptible to pain. Like I gotta tell you, I got I had this once for an a nerve test, which it's not the most comfortable test in the world. It's a couple little shocks, a couple little needles. And I'm doing my little nerve test on this, and this 80-year-old lady or something, she's falling asleep on me. She's like, oh, are you done yet? And I'm like zapping all the way up, because I'm a new and also I'm a resident. I don't even know what I'm doing that well. And he's like, oh, just zap her again. She's like, she's not like, okay, thank you very much. I'm like, okay. Then because our hospital is attached to a county jail, so a lot of these county jail guys, they just want to get out of the time there. So they're like, oh, I got neck pain. So so we just send them all for a nerve test. Because what else are we gonna do? Yeah. So we send them for a nerve test, and we put the alcohol. I'm like, oh man, I'm going back to the jail. Like, I didn't even do anything yet. So it's all relative.
That's interesting, because sometimes on the legal side we get the defense, insurance companies saying, hey, this person's exaggerating.
Well, no, and you can't measure pain. Pain is all subjective. My wife cooks every day, and she gets these burns, like on a regular, not on purpose, obviously, but she gets burns. She does little cuts. She never even mentions it. I get one little paper cut. I'm telling the world how terrible this is. My wife had kidney stones, and she's tough. I mean, that's probably the only thing to ever break her. Childhood, nothing broke her except for the kidney stone. Yeah. For me, I mean, it's completely different. As I said, the bigger and stronger the guy, usually the bigger the wimp. But it's all different. Some people say redheads have more pain, have less pain tolerance. I don't know how much truth is that, but there's a whole bunch of stuff out there that is just, it's all relative. So you
pain
can't
is unique, and pain is particular to the person.
And the new paradigm of pain is very interesting also. This came out only a few years ago. And I actually gave a whole lecture about this at one of the California conferences. Yeah. Pain is not what you think pain is. Pain is the sensation, is almost like a warning flag that there's danger in the body. Yeah, but the further you get away from the pain, the less the actual injury relates to what your body feels. So let me explain that a little bit more. Yeah. Okay, so let's just say I kick you in the shin. I don't want to kick you in the shin. Let's just say I kick you in the shin. Yeah, at that moment and there, you're feeling a lot of pain because I kicked you really hard. Yeah. Now let's just say it's a year from now. You don't have any more injury in that. There's no more injury there. Why are you still having pain? Yeah. Well, now maybe you develop chronic regional pain syndrome. Maybe there's some other tissue, there's some other issue going there. But
it still originates from that acute trauma.
But the actual injury, if you do an MRI, if I MRI your shin, there's nothing there. And they're going to say, you're not in pain. This is all clear. I'm like, no, there's something else going on. You could have what's called sensitization, where centrally or peripherally, and you could have all the other pain syndromes secondary to that primary injury, even though the primary injury is not really related to it. That pain sensation. So basically your brain, just think of your brain is just like there's some guy in a cubicle like this. Yeah, okay. And he's just looking at the paper, just looking at the tape, like like those 1930s, so looking at the tape. Yes. This is all he's doing. Oh, pain. Yeah, pain all day long. But now, that all he's getting is that signal. This guy in the little cubicle doesn't know what's going on. He's just getting his little tape. What's happening is this signal keeps on getting sent up. So that's why a lot of the medications that we use now, they stop, like, for instance, you take gabapentin. All it really does is stop the signal going to the brain. It doesn't do anything to fix anything, but people feel significantly better.
Okay. So it comes back to the function. You still have the pain, but it's function. So the idea that you may have to live with pain, but we're trying to make it so you're the best functioning that you can be.
And keep in mind, don't even forget, I kicked you in the shin. So now you're limping on one side, but now you're hurting your other knee because you've been limping on the other side.
It's unseen, but it's related.
Absolutely. It's a secondary consequence.
Okay.
And that's something
Secondary
that
consequence.
a secondary consequence to the your initial shin injury could now be your hip, and now you're walking weird with your back. And I mean, it could compile and you could go on. But the fact is, this is why it's so important. And this is what I talked about a little while ago. It's so important to be aggressive when someone comes in for their first treatment, just like, we'll do a little physical therapy. No, you want to like right then and there, let's get you a TENS unit. Let's get some acupuncture. Let's get some stretching programs. And you want to hit that hard. If you don't hit that hard right from the beginning, then next thing you know, you're going to be dragging this thing along, and that's a greater and greater chance that someone's going to develop chronic pain.
Secondary to it.
Yes.
So, that is really wild. And so kind of what it makes me think about to kind of wrap things up is, for those out there listening or watching, if they have some sort of connection to what we've been saying today, what is it that you would tell those folks or their friends and family about, whether they know somebody who has chronic pain, or this, they were kicked in the shin, but now they have this hip issue
I apologize
a year later. This. No. But what would you tell that patient, that potential patient, to do? What should they be doing right now?
They should be seeing a doctor who is going to address the therapy needs that they need, the therapeutic modalities and the treatments, and be aggressive in treatment, and don't just accept status quo. You can get better. There's no point to say, well, I give up and this is my life now.
Yeah.
There will be a point where you may not be able to function, but there's always something that you can do. And I tell people, do not give up on it. Okay. I tell people we have plan A, plan B, plan C. I have people, I'm on plan Q, plan X. We're just going on and on.
Yeah.
There's so many, if you look, there's so many modalities and so many things that we could get there. And one of them is going to help them. We're going to get there.
Wonderful. Well, Doctor, I want to thank you so much for joining us. This has been fantastic.
I love it. I had so much fun. I love hearing myself talk.
Yeah. Hello again. This is Rory Pendergast, attorney at Rory Law. Personal injury attorneys here in San Diego, servicing all of California. One of the things we get is questions, whether it comes from the intake, from when we first meet a client, whether it comes from throughout the entire process, or from all of our social media hits. A lot of people have questions. And so because we just talked to Dr. Kasendorf about chronic pain, we're covering all of these questions, kind of the main questions people may have about chronic pain, how it impacts a legal claim, how it impacts the way that they can prove it, all of those sort of things. So we'll jump right into it. And so to start out, one of the main questions in this realm, in this kind of chronic pain realm I get is, question, can I pursue a legal claim even if my main injury is chronic pain and not a broken bone or visible trauma? Yes, yes, yes. In fact, most of my claims, we're not dealing with broken bones, right? You're dealing with tissue, you're dealing with all sorts of other medical issues, and they are unbelievably painful. And it's when it comes down to chronic pain. And so even if you have a broken bone that then the bone itself heals, everything should be good, you develop this sort of chronic pain, it can be a terrible, terrible instance for the person. It can be debilitating. It can really kind of impact your functionality in life. And so one of the biggest ways that I can show this, again, is it comes down to this. Number one, you have to know your client. That's what it comes down to. You have to know your client. And the best way that I get to know a client is, one, spending time with the client. If I can, I like to go out and visit the client in the client's home, in the apartment, at their work, wherever I can get to know who this person is. And then more than that, the worst person for information that I can talk to usually is the victim, is the client. Where I get actual gold are those, the loved ones, the close in heart or close in proximity. If your brother lives 2,000 miles away, but you talk to your brother every day, Or if you have a grocery clerk that you see 3 times a week, you may not know that grocery clerk's name, but these are the people that you communicate with, and these are the people that are seeing how you're getting, how this is impacting you. And I'm telling you, these people have absolute gold. And so what I do is I either go talk to the people, I've got my staff that can talk to the people, we've got a certain way of doing this. I review what is getting said, and that helps me develop kind of further questions of how to, dig deeper with the client. And then you start to see sort of patterns with this. And really what happens is you start to see where you can truly help the people. Because what I'm trying to do, whether it's chronic pain or whether it's acute pain or whether, any part of this, is it's not just about money, right? It's kind of it's a gross system we can't unbreak a bone. I can't unhave that car hit you. But what we can do is we can get you compensated, right? Because that's justice in the civil justice system. Justice equals compensation. But what I want to do for each of the clients, whether it's chronic pain, whatever you may have, is I want to get you justice, but I also want to identify what is it that's going on so you can get over what's going on. I want to take you from one side of that raging river and get you to the other side safely. Question 2, how do I prove chronic pain in court? Improving chronic pain in court it can be difficult if you don't give the time with your client. And so one of the things that I like to do to be able to prove the chronic pain is it comes down to, as Dr. Kasendorf said, he wants to know his patient, I want to know my client. And the best way to know the client is to spend time with them at their home, on the phone, any way that they feel comfortable. And the biggest way is to talk to those that are close to the person, right? Close in heart, as I like to say, or close in proximity. If you talk to your brother that's 2,000 miles away every day, or you just talk to somebody else that's close to you, it's these folks, they're the ones who notice the differences. And so what we're looking for is, what is the difference between how you were and how you've been since that? And that sort of description is absolute gold for trying to prove this in court. And then also really the kind of the bigger picture from Rory Law is trying to get you better. Question number 3. What if the insurance company says I'm exaggerating my pain? Well, this is not even a question, because every single insurance company is going to say you're exaggerating your pain. You could lose your legs and they're going to say that, well, you're exaggerating your pain. The biggest way that you can deal with trying to the go-to defense, the go-to insurance claims of saying that you're exaggerating your pain is to document everything. Dr. Kasendorf said that what he likes his patients to do is keep some sort of diary, whether it's on your phone, whether it's physical, it's in a notebook, you write it down, whether it's a voice memo. And really the best way to do this is if you can, throughout the day, throughout the week, what is it that's hurting? What time of day is it that's hurting? And then what is it that makes it better or worse? These are huge things. And if there can be just some sort of consistency, and then when you see your medical provider, make sure to tell your medical provider this. Now with electronic health records, the doctors, the providers, they love when you show up with information, because all doctors, they want to help you. And the best way that they can help you is that the more that they know. Sometimes they're on a time limit. So the more information you can you can front load it, the better. The other thing with that is that once you tell a doctor something, they have to do something about it. So if you tell them about how, hey, as Dr. Kasendorf said, yes, this patient is taking medication in the morning and it's at night when the pain kind of sets in. Well, that's an easy fix for the doctor to say, hey, let's move when we're going to give the medication. So there are definite ways to show definitively that it's a garbage sort of idea that you're exaggerating your pain. All right, number 4, can emotional distress from chronic pain be part of my lawsuit? Absolutely, emotional distress of chronic pain can be part of the lawsuit. Here's the deal. When you have chronic pain, it impacts every other aspect of your life. As we talked about, for example, when you have chronic pain, oftentimes you can't sleep at night. So then if you're used to exercising in the morning and you didn't sleep at night, now all of a sudden you're not exercising in the morning. Well, it's not just about physical exercise. It's about having a clean mental space, starting the day in a proper way that then throws everything else off. Maybe you're more irritable. Maybe you just can't handle it. You can't function as you used to function. And not only that, from the internal side, externally, you're acting differently towards people. So those that love you, that care for you, that provide you energy may not be giving you as much as they did before. And so absolutely, that emotional distress that comes with it is part of it. Now, from the legal side of it, there are actually, with the jury instructions. It's law that if you get to a trial, at the end of it, you've done your closing, the judge up there sits and he or she looks at the jurors and they say, jurors, here is the law. And there is actual law on emotional distress. You have on anxiety, depression, PTSD. If there's been any sort of dramatic change in your life, this is the stuff that the law itself says is compensable. And whether it's from the trauma from an incident, or if it's from long-term chronic pain, the emotional distress that's a result of that, you can absolutely be part of that lawsuit. Right, moving on. What if my chronic pain didn't start until weeks after the accident? Can I still file a claim? Well, usually long-term pain, chronic pain, kind of that lingering pain, it doesn't present itself, it doesn't show up until long after the accident. And as we talked about today, sometimes you have a different part of the body that suffers pain, right? If you hurt your knee, if you hurt your shin, if you break an arm, it might take months before some sort of other pain pops up. So for instance, somebody hurts their leg because they've fallen. They've taken a fall, right? Usually what happens is that they're limping. And when you're limping, what you're doing is you're putting more energy, more weight, more stress on the other side of the body. And so even though it's a seemingly unrelated part of the body that gets injured, it is a direct result of that initial injury. And so, but that stuff, it doesn't come immediately, right? The acute pain that comes, if you get into a motorcycle crash and you break your arm, right? Well, that's the immediate pain, yes. But anything that comes from it, there are actual jury instructions that say, is this related? If it's related to the underlying injury, if your hip pain is related to the knee pain that happened immediately, it is absolutely compensable. And this is, again, why it's so important to have this stuff documented. And by documentation, I'm not saying you're going down to a notary and having it notarized every day. It's just something that you keep in, your everyday. And it doesn't have to be every day. It can be every week. It can be every month. If there's some sort of consistency that you're able to document chronic pain, that's the stuff, that's evidence. It's not only evidence that you can use to show it, it's evidence that you can bring to your doctor to have the doctor highlight it. How can I demonstrate the impact of chronic pain on my daily life in a legal claim? So this is a great question. So demonstrating the impact of chronic life, here's what it comes down to. As we, I feel like it's just repetition, because it's this easy, yet it's this difficult to get to. And what it comes down to is just kind of being aware of what's going on in your body, right? And you're aware of what's going on in your body by keeping that diary, by keeping those notes, by keeping some sort of idea of when some sort of pain pops up, some sort of notation. Getting that to the doctor so that the doctor can kind of see it. But then again, it's having an attorney. Like at Rory Law, what we do is we go and we talk to you, the client. We get to know you. We talk to your friends. We talk to your family. And those are the folks that really can understand what's going on. Those are the folks that can really see what's happening. For example, I had this really lovely, wonderful family. They were in a McDonald's parking lot and they were hit by this drunk driver. Luckily, the guy wasn't driving very fast. And the mother, the matriarch, she didn't talk a lot, but she kept, I could tell that she was in pain. And she was just this tough lady, kept it all in, wasn't in pain. I talked to her daughter, and finally I get the daughter to say, flippantly, I was like, hey, what is going on with your mom? Tell me somewhere where you've noticed something different. And she says, you know what? When we sit down and have family dinner, I ask my mom for food, and she can't pass the dish. She can't pass the dish because she had a shoulder tear, and so she couldn't extend her arm with weight on it. And that told me so much. One, it told me that, hey, we can identify where the pain is coming from. Even though mom isn't telling me anything, I can identify, hey, that's a shoulder thing. But then more than that, you think about, as the attorney, this is a family that sits down to eat dinner every day, right? And then even more than that, what every mother wants to do is feed their child. And so, yes, I get it. The kid's eating, somebody else can pass the food. But as a mother who's passing this dish and physically has troubles giving mother the food, that is chronic pain, and that is the perfect highlight of how to show chronic pain in court. So a couple other questions that we have that are kind of related, and it talks just the idea of how should the client or the attorney kind of approach documenting these things for legal cases. And then that same sort of idea is, why is it so hard to prove that in court? And these things are so interrelated, because when you have one, you have the other. But if you're missing one, you don't have the other. And so really, again, what this comes down to is that the approach for documenting it is being aware, right? And how you're being aware is keeping track of what's going on. Again, it doesn't have to be daily. It doesn't have to be throughout the day. It can be weekly. It can be monthly. But just having some sort of awareness that's written down in some format that you can then take to your attorney, you can take to the doctor or doctors who you're seeing, and then they can really evaluate what's going on. Because how do we prove it in court? Well, if it's in a medical record, it has significance, right? And if it's in a medical record, then the doctor for the defense has to deal with it. And more than that, all of these, as we've talked about, kind of one thing that Rory Law does is we go out and we talk to the friends and family, those that are closest to you, and those statements, we give those statements to the doctors. We give to the treating doctors. We give those statements to the experts that we're going to use. And we give those statements eventually to the defense experts. Because it's one thing for a defense doctor to say, the plaintiff is lying, exaggerating, because they have a financial interest in it. So again, this is important. Defense doctors can always go back and say, well, that plaintiff has a financial interest in having exacerbated pain, having this chronic pain, and therefore that the person is lying. But when the attorney, like we do at Rory Law, when we have witness statements from people around you that are discussing, highlighting this pain, that defense doctor, that insurance company then has to go around and say, hey, that guy's lying, and everybody they know is lying, committing perjury, just so that other person get money. And that's just garbage. It isn't, right? So this is the best way to document it and to prove it in court. You've been listening to Unseen Impact. If you like today's episode, make sure to subscribe wherever you get your podcasts and leave us a review. It really helps others find the show. For more stories, updates, and information on legal-related topics, follow us on Instagram, TikTok, and YouTube at Rory Law Firm. You can also learn more about our work or book a free consultation with us at rorylaw.com. Thanks for being part of this conversation. Remember, justice isn't just about what happens in court, it's about what happens after.